For those of you who are joining us for the first time today, the California Local School Wellness Policy Collaborative is a group of representatives from school wellness-focused organizations. Our purpose is to implement highly effective local school wellness policies in California schools to support student health and academic achievement. Our domain chairs are leading this series of Winning at Wellness webinars to share information and resources intended to support partners in a school wellness work. So today our webinar is being presented by the and Evaluation of Local School Wellness Policy domain. So it is my pleasure to turn it over to Mike and Mary Ann this morning without further delay. So Mike and Mary Ann, go ahead and take it away.
All right, good morning, everyone. Welcome to our webinar. We're really excited to have you on today, and we're going to have some really great presenters to share some of the great work that they're doing. As Allison mentioned, Mike and I are the co-chairs of the Local School Wellness Policy Implementation and Evaluation Work Group, and so today we'll be sharing some updates, and I'll turn it over to Mike to introduce himself.
Thanks, Marianne. And yeah, just really quickly. So my name is Mike Danzik, and as Marianne said, we're co-chairs of this wonderful domain under the collaborative. And so I personally, just real quickly, I work for the California Department of Education in Nutrition Services. So that's my role on a daily basis. And from there, we will go and forward to the next slide, please, and we'll let you know what we'll be talking about today. So again, welcome everybody. So the next 57 minutes will include a brief explanation of some of the important wellness policy information regarding this particular school year. We might want to make sure we share that with you. And then we will pass the mic over so you can hear directly from your peers. We have two wellness coordinators. We'll reintroduce them when they're ready to present, but we have Kate McDevitt from San Diego Unified, and we have Hannah Smith from San Francisco Unified, who will share with you their stories on how they've kept wellness going in their districts. Next slide, please. So again, as Marianne mentioned, today's wellness webinar was developed by the Local School Wellness Policy Implementation and Evaluation domain. It's quite a mouthful. And again, this is one of the subcommittees of the larger California Local School Wellness Policy Collaborative. We'll share with you a couple projects that we're working on in this domain this year. And then lastly, we'll wrap up with Siobhan Simmons-Wright. She's with the Alliance for a Healthier Generation, and she will be highlighting their model policy. So throughout today's webinar, we encourage questions and just ask that you submit them through the chat box. And then at the end, we will go ahead and address as many as we can. And if there is any follow-up, there will be ways for you guys to get a hold of us if there's any burning questions that we do not get answers to today. Thanks.
All right, so I realized at the outset I forgot to introduce myself and where I work. I was a little distracted, but I'm Mary Ann Mills. I work with the CalFresh Healthy Living University of California State Office, and I'm a program manager there. Okay, so now that we've gotten that out of the way, we wanted to start with a fun warm-up activity. So I know 2020 was kind of a difficult year for a lot of people. And I think we're all excited to be in this new year and looking forward for what's to come. But it's also important to kind of reflect. So we thought this activity would be a fun way to reflect back on last year while also looking forward. So if you can, please type into the chat box one thing that you were thankful for last year, and also one thing that you're looking forward to this year. And as you type them in, I'll read them out loud. Oh, this is great. Somebody said birth of their grandson and becoming a grandma. That's amazing. Congratulations. 2020 wasn't all bad. What else are people thankful for? Let's see, friends and family, nature, meditation. Looking forward to the vaccine. Yes, definitely. Looking forward to more time outdoors. People are thankful for quality time with family. Someone said they were thankful for San Diego weather. I am jealous. Someone said they're thankful for their food service team. Absolutely, props to food service always, but especially in 2020, they are heroes. Keeping family healthy and safe. All right, I'm seeing a lot of great stuff in the chat box. Thank you so much for participating in this fun warm-up activity, things that you're thankful for and what you're looking forward to. All right, so, oh, this is Mike, right? You're muted, Mike, sorry.
Yeah, that's okay. Thanks, Mary Ann. Thank you very much. So hopefully we kind of got the wiggles out a little bit with that. And so we're gonna jump right in. And I just want to take a few minutes just to kind of set the stage of where we are with wellness policy. And just to remind all of you some of the requirements that will need to be addressed this year. So the first being the Triennial Assessment, potentially. So if you or your districts that you work with submitted a wellness policy Triennial Assessment waiver, that waiver allowed the district an additional year to complete their assessment. Remember, it was due to be completed in June of 2020, but the waiver allows you or your district to complete it by June of 2021. And just points to remember in regards to that. Remember that this assessment is for the district in order to really continue to successfully implement their wellness policy. They don't have to submit it to the state, but it is part of the state's review during the district's next scheduled administrative review. So you will be asked about it, but it isn't something that you need to complete and submit to us. It's really, again, your document for success for wellness. In addition to the triennial assessment, districts must also provide an annual report. And this is fairly way easier than the triennial assessment to complete. It just includes informing the public about the content and implementation of the wellness policy and make the policy and any updates to it available to the public. And so that is an annual requirement. So again, that will need to be done this year as well. And with that, as a segue to our guest speakers who will share their local level experience, I'm hopeful that there is a light at the end of the tunnel. Someone said a vaccine. And so it is kind of nice to be able to see something towards the end there. But with that, we understand all the challenges districts are facing, continuously facing on a daily basis. And we as the collaborative are here at the ready to share with you resources, be they written, electronic, or actually in human form. And speaking of humans, I'd like to now introduce Kate McDevitt. And again, she's the wellness coordinator for San Diego Unified. So take it away, Kate.
Thanks, Mike, and good morning, everyone. It's nice to see a lot of familiar faces today. And for those of you who I haven't met, I'm happy to be with you. I'm going to be speaking about San Diego Unified's District Wellness Initiative, and we can go to the next slide. As Mike mentioned, I'm the District Wellness Supervisor for San Diego. I joined the district in 2016 and had been doing a lot of work prior to that on school wellness implementation in San Diego County. I work for the second largest school district in San Diego, and we have over 100,000 students and close to 15,000 employees now. And we support 175 schools through our wellness effort. Go to the next slide. So in our district wellness initiative really works to support physical, emotional, and social health. And we do that through our policies, practices, and systems, which I know many of you are working on as well to promote healthy school environments. Next slide. Our district wellness initiative has 6 key components. I'm going to talk through a few of those today just to give you a snapshot of where we are. But as a quick glance, these are the 6, and we will run through them. Next slide. Before I go on, I have to stress that in San Diego, it is truly a collective effort of thousands of people across our system, staff, students, parents, and definitely our community partners as well. Next slide. And for our collective efforts, I'm really proud that we've been recognized at the, at the local, state, and national level for our efforts. And we're especially proud to have, for the last 4 years, received the American Heart Association's Workplace Health Achievement Index for the last 3 at the gold level. Next slide. So I want to talk first about what wellness looks like at the leadership level in our district. Next slide. I would be remiss if I didn't start by saying that our superintendent, Cindy Martin, has truly been a champion for wellness in San Diego. And I am very proud that yesterday it was announced that she's been tapped by Biden to be his next Deputy Secretary of Education. She is a true champion for wellness and has been by my side through all of this. So we are very proud of her. Next slide. Now, in San Diego Unified, we have a district wellness council that convenes on a monthly basis. And since the spring of 2020, we have been meeting virtually. We've actually seen we have had an increase in participation in our council being on Zoom. As Marianne and Mike mentioned earlier, sometimes that makes it easier for people to participate. And we have roughly 50 to 60 members attend each month. We have 14 departments represented in the district, and we have, if we go to the next slide, more than 30 community partners. Some of them are here with us today, and a big thanks to them for all that they do for us. We can go to the next slide, Marianne. Our district wellness policy does have 9 different components. We modeled off of the whole school, whole community, whole child model. So you can see here, not only do we focus on food, nutrition, physical activity, and physical education, but we're really trying to promote comprehensive health throughout our district. And we do that by forming in our council subcommittees for each of these 9 areas. So our council meets once a month, and then the subcommittees also meet to talk and have more deep conversations on the needs and gaps within our district to see how we can move forward in key areas. So that's been critical to our success. If we go to the next slide, I wanted to talk briefly about what's happening at our school site level. So we can go to the next slide. At every school in San Diego Unified, we ask principals each year to designate a staff member to be their school wellness coordinator. And for this, that school wellness coordinator is asked to convene a school wellness committee that should be comprised of students, parents, community partners, and staff. And we ask them to go through a process with us each year to make sure that wellness is on track in their district and that they're really working towards goals to improve over time. So on the next slide, you'll see this is at Ocean Beach Elementary School, one of our award-winning schools in the America's Healthiest School Award this past year. You can see this is their wellness committee. They had grade level student wellness ambassadors that are sitting at the table there. Their principal is the gentleman on the left, and then they have parents and staff and community partners at the table as well. And they've just been a phenomenal model for us of what is possible. And so kudos to them. So if we go to the next slide, each wellness committee in San Diego Unified follows the Alliance for a Healthier Generation 6-step process each year. So we start by building that team, the wellness committee. Then they assess how wellness is being implemented at their school. Each year they develop an action plan with projects for student wellness, staff wellness, and family wellness. And then they use our community partners' resources and the district's resources, which we introduce to them, to take action. And by March of each year, they've turned in their plan and they are starting to implement their projects. Many of them now start working on their projects in the fall, but we want to make sure they have time to get everything set up. And then we always in May celebrate success. They turn in an end of year report highlighting their key areas of improvement and areas where there may still be gaps and need for additional support. Next slide. Now, one of the big changes that we made this past year with COVID was moving to a virtual model. And Marianne, I'm not sure if the slide's stuck. There we go. But we have moved to a virtual model for meeting with our school wellness coordinators. So in the past, we would meet for a full day in the fall to provide them a comprehensive training on school wellness. So we're having these virtual huddles on a monthly basis. We offer 4 sessions per month, so school wellness coordinators on different schedules can join us. And we can go to the next slide. And in those huddles, we're really focusing this year, we're using Kaiser's playbook to really focus on areas that are most appropriate for this COVID environment. So we have these key areas: mental health and well-being, COVID prevention, physical education, social drivers of health. and staff and teacher well-being that we're really focusing the huddle discussions around. So school wellness coordinators can talk to one another, and then we can share resources from the district. Next slide. I'll just mention very quickly that we also are very thrilled that our students have been meeting as well. So this is one of our high schools. They have a student wellness club, and they've been continuing to meet over Zoom to make sure plans are continuing. So we're very happy for efforts like that. Next slide. And then I'll mention briefly what's happening with wellness at the student level. We do have a couple of key efforts. Next slide. We have in San Diego Unified 26 centers for health and wellness. That's 9 school-based health clinics. We have 12 Healthy Start collaborative sites, which are like family resource centers. And then we also have our 5 high school wellness centers. And these work to make sure that at the one-on-one level, students are able to connect to the resources they need and get the kinds of support for their physical, social, and emotional health. Next slide. We're also thrilled that this year our district has a SWARE committee, which is Student Wellness Education and Resources Committee, that was launched by the 2 students you see featured here, Hannah and Catherine. And they have ensured that at every high school in our district, there is a SWARE committee representative. And those high school students are working collaboratively to create plans from the student perspective on what wellness can look like in our district. And we are so excited for their efforts. Next slide. And then at the staff level, next slide, we have developed a staff wellness website to make sure that staff are connected to the resources that they might need. Next slide. And we've also launched a staff wellness webinar series. So on a monthly basis, we're now offering our 15,000 employees opportunities to connect to resources to support their social emotional wellness, their work-life balance, and really have stress reduction techniques, which we know are needed at this time. We also have a wellness committee, a subcommittee on employee wellness that meets every month, and they help to ensure that we're managing the resources for employees across the district and representing both our school and administrative offices. And then lastly, I'll mention we would not be where we are for staff wellness without our health insurance carrier, California Schools EVA. They have opened a resource center virtually to provide fitness classes, etc. And Kaiser and United Healthcare have been working alongside us in our wellness efforts there. Next slide. So that is a very quick run through of our 6 areas of our district wellness initiative. I didn't mention growth and development, but certainly we are always looking to expand upon our efforts and make sure that this system is growing. Next slide. And we want to make sure to just mention that we really are striving to create a culture of health in San Diego Unified. And we're really starting to see that in terms of increased understanding of the wellness policy and the resources available. And a lot of staff are now articulating that wellness has become the norm in San Diego Unified. So I'm very proud on behalf of all of the people who have made it happen in our district that that is the case. Last slide. I'll just say thank you for this opportunity to share. I know it was a lot of information in a short amount of time. If you have any questions, my contact information is here, and I'd be happy to support your efforts. Thank you.
Thank you so much, Kate. It's always lovely to hear from you and hear the great work that San Diego is doing, and really helpful to hear what you're doing currently in the COVID climate. I think a lot of people are kind of struggling to figure out how to continue to support school wellness policy during this time. So thanks for sharing some examples, some tangible examples that people could take and use in their own districts. If you have questions for Kate, please type them in the chat box. As Mike mentioned, we'll be answering questions at the very end of the presentation. And as Kate mentioned, you can always contact her as well. So next up, we have Hannah Smith, and she's from San Francisco Unified School District. She's the wellness coordinator there. So I'll turn it over to Hannah.
Great. Thank you so much, Marianne. Thanks for having me here today. And I'll echo that it's so great that so many of you were able to join us here today. Seeing some familiar faces and some new faces. Like Marianne mentioned, my name is Hannah Smith, and I work at the Wellness Policy Coordinator at San Francisco Unified School District. We are a large urban school district with over 57,000 enrolled students. My position is a bit unique. I'm housed within the Student Nutrition Services Department of the district. So it gives me a specific focus and lens on the implementation of the wellness policy within the Nutrition Services Department. I also want to recognize that this is a team effort. I have many members of my wellness policy team that do this great work alongside me. So just wanted to mention Saida Hafiz, Hade Rivera, Mark Elkin, Mike Drum, Maya Postrish, and Donna Gurr that all do this great work and push this forward. So shout out to them, and we can move on to the next slide. So to provide an overview of the district wellness policy at SFUSD, we approach the wellness policy through the whole school, whole community, whole child model, and is informed with a racial equity schema. Our highest aspirations are to create school environments where the healthy choice is the easy, most desired choice for all students, as well as staff, families, while also acknowledging and addressing the issues and challenges faced by those in crisis. We have committed to this and particularly focused on our most vulnerable youth, our African American students with academic achievement and health disparity gaps. SFUSD's wellness policy is a student-centered policy, and our work typically focuses heavily on projects that mobilize students to claim their autonomy over their own health and to define their own sense of well-being, and then change the factors in their school environment through community engagement. And we do a lot of project-based learning, or PBL. When our schools closed back in March of last year due to the pandemic, we had to quickly rethink and shift how we were going to do our work. And so there's been many challenges, but this time has allowed us to dive into some new areas of our wellness policy work, as well as work more deeply in some existing projects that we might not have been able to do during usual circumstances. Next slide. So we've used this time to rethink some of our existing areas of work, such as how we provide school meals to students and how we provide employee wellness opportunities to staff. I'll discuss our approach to school meals in a little bit more in depth later. We've also used this time to do a deep dive into some projects that will allow us to implement the wellness policy in an effective and purposeful way when in-person learning is back in session. So some of these projects include studying and analyzing the data to develop our Triennial Assessment. As Mike mentioned at the beginning, we've assembled a team to build a whole new wellness policy website. And we're also in the midst of updating our actual written wellness policy document. We've also found some really creative ways to interact with students in the virtual space, which I'll share a little bit more on later. But our food corps service members have also been providing nutrition education lessons to students in the virtual space, and connecting our Harvest of the Month programming with our grab and go meal sites. So coordinating the produce items that we're serving at those grab and go sites with the Harvest of the Month and the education that the students are receiving in the classroom, the virtual classroom. And we also, the food corps members have distributed some at-home gardening seed kits recently, which has been really fun. The wellness policy team has also submitted a number of recorded videos to our district's educational television show, which is called SF Loves Learning. I'll dive into that a little bit more later, and I've got some videos that folks can watch. All right, next slide. So I'd like to provide some detail on some of the successes and challenges that I've touched on. So beginning with our grab and go meal distribution. So on March 17th, which was just one day after SFUSD's schools closed, we began providing free grab and go meals across the city for students. We serve these as what we call a walk-up window, and this is at 18 of our school sites. This program has served over 4 million meals since schools closed last March. This work has been incredibly essential to ensure students have access to the nourishing food and school meals during virtual learning. And in San Francisco, we are a bit unique, as most folks don't drive. We're not a car culture. And so we rely on walking and public transit to get around. So we had to develop some innovative ways to serve families without having a drive-up method that many districts are using right now. So we needed to brainstorm and find ways that it would be easy and reliable for families while also safe for our staff. This model has been a great success for us. It's been a learning journey. We've revamped and changed a lot as we've gone on. You can read some of the feedback we've heard from families on our slide here about our grab and go meal program, which is always really inspiring to hear and helps keep us going. We also knew that the grab and go meals would not serve everyone. So to address students that could become especially vulnerable to food insecurity during this crisis, we launched what we call our door-to-door delivery program, which delivers meals to the homes of students with disabilities or special dietary needs. We're still doing that. We've just expanded that program recently, and it's been a success and taught us a lot. Never done school meal delivery before this. Next slide. So next, I want to highlight some of the creative ways we've been able to connect with students. So SFUSD partnered with our local KTVU news station to create an educational television show called SF Loves Learning. The show target audience is kindergarten through second grade students, and it airs every weekday morning. The show is created entirely by SF Public School educators and partners and models our district's core values. We're on season 3 of the show now, and the Wellness Policy team has developed and submitted a number of videos that have been featured on the show. Really exciting work, something I had never done before. This has been totally new, but something we've enjoyed, and it's been an exciting challenge to get to learn new skills in video recording and cinematography at home. And the team has gotten really creative and done some fun videos on topics such as healthy breakfast and snacks, mindfulness and stretching, movement and physical activity. And we've done some produce features for our Harvest of the Month program, as well as a number of topics focusing on social emotional learning. There's a whole session or series on that. And also our Student Nutrition Services team has been featured on the show every episode with some slides that outline the sites and times and days that families can pick up their grab and go meals, which has been a really important and great outlet to reach families with this information. I've included some clips here on the slide. I apologize. Oh, looks like they're slowly popping up. There they are. So those are 3 clips from the show. So feel free to check those out. I welcome you to enjoy hearing about planting seeds, healthy breakfast, and some yoga and growth mindset. And then the link at the top there, SF Loves Learning TV show, is the YouTube page held by the district of all of the episodes. So you can check those out. Okay, next slide. The last piece I want to touch on is some of the more behind the scenes projects we've been able to work on during school closure. So given that much of our traditional work is direct student engagement that has been put on pause, we felt that this was a great opportunity to work on some larger, more behind the scenes projects. So we've used this time to really do a deep dive and pull and analyze a lot of data from a variety of sources to develop our wellness policy triennial assessment, which in turn will allow us to launch student-centered projects and implementation work that is driven by new and up-to-date data when it comes time. We've also, as a team, we're in the midst of developing an entirely new wellness policy website with the target audience of the whole school community. So we'll have special sections on there for educators, staff, parents, guardians, stakeholders, and students. We envision this website to be all-encompassing, so it'll serve as a resource and a platform to highlight the amazing work that our school community has done to implement the wellness policy and also be a resource to direct folks to. And then we're also using this time to update the policy itself. So lots of behind the scenes projects going on. Next slide. So we've learned a lot over the past 10 months, and we're continuously shifting and altering our response to this ever-changing environment. But we've really risen to this challenge and have found some great opportunities to do some work that we might not have been able to do before. So thanks so much for this time, and happy to answer any questions you might have. And my email is not on this slide here, but happy to share it with folks. Thank you.
Great. Thank you both, Kate and Hannah. You guys are extremely inspiring, amazing leaders out there for wellness, and you've been able to share that things can actually be accomplished during this crazy time. So thank you very much for sharing. We wanted now to explain a little bit about the domain that Marianne and I co-lead, and some of the work that we're doing this year as well. So next slide, please. Again, I think I mentioned earlier, but we're one of 3 domains of the California Local School Wellness Policy Collaborative. And our implementation and evaluation domain is focused, our purpose is focusing or supporting districts in ensuring that they meet the wellness requirements, of course, including the Triennial Assessment.
All right, and so for this year, we did identify some objectives for our domain, some things that we really want to accomplish this year. And as Mike mentioned, a big focus for the domain is the Triennial Assessment, because a lot of districts are currently in the process or planning to soon begin their Triennial Assessment for the USDA requirements. So our first objective is to develop a template for local education agencies to use that will really guide them through the Triennial Assessment process and ensure that they have completed all of the components. And along with that, we also plan to provide a training to local education agencies, as well as technical assistance providers at the local level to kind of guide them through the Triennial Assessment, orient them to the Triennial Assessment template, and make sure that they're well prepared to complete that process. And then our last objective is not Triennial Assessment related directly, but it's very important. And we'll have more to come on this when Siobhan presents, but we plan to collaborate with the Alliance for a Healthier Generation and Kaiser Permanente to create a California-specific model wellness policy. And this has been something that has been needed for quite a long time because there are some unique requirements in California. So we're very excited about this objective. All right, if I can advance.
Oh, thanks, Marianne. For those of you who are extremely familiar with the Triennial Assessment, this will be review. And for those of you who may not know the nitty-gritties, I'll just spend a quick minute to go over what districts must do. So they must, first of all, conduct an assessment of their wellness policy every 3 years at minimum, hence the word triennial. It's a new word for many of us in our vocabulary. And according to the requirements, the assessment will determine 3 things. One, the extent to which the local education agency or the district wellness policy compares to a model local school wellness policy. So that's one part of the assessment that you'll need to complete. The extent to which schools within the district are in compliance with the wellness policy, with your own wellness policy requirements in your policy itself. And then the third is a description of the progress made in attaining those goals, because of course we know, again, specifically what's happened over this last year. Many plans got thwarted, but we still want to better understand, or have you as the district better understand what progress was made, so then you could alter that as needed. So those are the main areas of what will be included in the Triennial Assessment.
Okay, and so as you saw in our objectives, they're very Triennial Assessment oriented. This work group is really focusing on creating documents and trainings to support the Triennial Assessment. And this is our timeline for the Triennial Assessment. Just expect information from us in February. We will be sharing out the final actual template for districts to use. And then in March, we'll be providing a training on how to use that template. And then of course in June 30th is the completion date for the Triennial Assessment. Hopefully I didn't freeze that time. I'm going to turn it back over to you, Mike.
Thanks, Marianne. And I would say for all of us, if we are nothing, we are flexible and understanding. So carrying on. So again, as Marianne shared, one of our domains projects is collaborating with the Alliance for a Healthier Generation. For those of you who may be a little bit familiar with their policy, it focuses on national health and nutrition standards and is recognized nationally as a model policy. But again, we know that California includes different and in many instances stricter requirements. So the Alliance, we reached out to the Alliance, Kate did, and then the Alliance reached back out to us. And we've agreed to kind of work together to create I don't know what we're calling it yet, but it's going to be a California specific policy. And really what it'll be is taking information that's specific to California and integrating it into their current model policy. The version, once available, can then be used by California districts, again, who choose to use their policy as a district template. So with that said, I'd like to introduce our last guest speaker, Siobhan Simmons-Wright with the Alliance, and she'll be able to share more about their policy. Siobhan?
Yes, and thank you all. Can you hear me?
Yes.
Perfect. And thank you all for inviting me today to talk about Healthier Generations Model Local School Wellness Policy. And as you all know, and if you don't, Healthier Generation works to empower kids to develop lifelong healthy habits. Next slide. So my name is Siobhan Simmons-Wright, and I am the National Policy and Environment, School Policy and Environment Content Advisor with the Alliance for a Healthier Generation. I've been with them for over 13 and a half years. And in this particular role, I have the opportunity to work with school districts and local education agencies across the country to provide technical assistance and support to develop and implement wellness policies. And prior to this position, I served as a senior Healthy Schools Program Manager for the state of North Carolina, where I am located. And I've worked with over 80 districts here, providing technical assistance to develop, implement, and monitor and evaluate local school wellness policies to create healthier school environments. So next slide. So now that you know more about me, I would just like for you to take a moment if you can go back and, well, you don't have to, but in the chat box, if you could just type in your name, your role, and the district that you are calling in from today. And if you just say yes or no, why or in, if you've ever used our model wellness policy, Healthier Generations model wellness policy. And as you're doing that, I'll go ahead and proceed forward with the next slide that's up right now. But if you can, just go in the chat box and have the chat box up. And if you could just mention who you are, again, your name, your role, and the school district that you're calling in from. And then also if you've used our model policy in the past to update or revise your wellness policies. So I'll wait for that. And then as you're doing that, I am also going to pop in the chat box the link to the actual policy that I'll be talking about today, highlighting today. So I'll give a few more seconds and then I'll proceed with talking about and diving in deeper. And thank you for adding that information. That's helpful for us too. So hopefully I'll be able to get that information. So just moving forward, Healthier Generations Model Local School Wellness Policy was recently revised as of August 2020 to provide a fresh new look and to include additional information to support the district's revisions of the local school wellness policies. Healthier Generation Model Policy is a guide. It is a guide that includes policy language that aligns to the USDA Final Rule of 2016 that meets the minimum federal standards for the local school wellness policy implemented under the Healthy Hunger Free Kids Act of 2010. So again, I just want to emphasize that it is a guide. It's a tool that can help support. The model policy includes the Alliances for a Healthier Generation, Healthy Schools Program Framework criteria, which sets higher standards for schools and represents best practices in school nutrition, physical activity, health education, physical education that can be included in the local school wellness policy to establish stronger language. And it includes the whole school, whole community, whole child model policy language as well. I was happy to hear that the two presenters before me talked about including and expanding or their wellness policies to include the WISC model. This tool can be used to guide districts to help with revisions and for updating the policy and to meet or exceed federal regulations. And the policy can also, this model policy can also be used to compare to policies to meet the triennial assessment requirements. So again, I know that Mike had mentioned that earlier, that you all are going to need to update and then also prepare for that triennial assessment. So Healthier Generations model policy, that I put the link in the chat box, and you'll see the screenshot here on this slide. This can be used as a model policy. So to dive in a little deeper, next slide. In order to be compliant with the USDA Final Rule of 2016, each local education agency, LEA, or school district participating in the National School Lunch and or Breakfast Program is required to develop a local school wellness policy. The responsibility for developing, implementing, and evaluating the local school wellness policy is placed at the local district level to ensure that the unique needs of each school district under the LEA's jurisdiction can be addressed. So that's really, really important that each and every school district has their specific information included in that policy. So here's another question, and you could think about it or place some information in the chat box. What are the requirements that are mandated to be included in the local school wellness policy? So take a few seconds to think about those. Maybe think about the total number, or think about some of the actual requirements and type those in the chat box. And this next slide is, yep, here we go. The next slide, a healthier generation, we love to walk the talk. So we include physical activity, our task cards, into our presentations. So as you're thinking about that, and as I take a deeper dive into look at the minimum requirements, take four deep breaths and 4 neck rolls to the right and left. I am standing right now, so I and encourage you all to stand with me and participate. Again, those quick physical activity breaks. Next slide. So as we go to the next slide, this slide highlights the essential components, the requirements. So this particular slide highlights nutrition, physical activity, minimum requirements of the USDA final rule, such as nutrition education and promotion, physical activity, food and beverage marketing standards, and food and beverage standards, which is listed on page 3 of the model local school wellness policy. So again, if you have a chance to look at it now, as you're either download it or look at it later, on page 3 we have indicated all of these and highlighted the actual requirements from USDA final summary. The last 4 minimum requirements are focused on public involvement, public updates, leadership, and evaluation plan, also listed on page 3. And I did forget to say next slide, so you're there with me, Mike. Thank you. Required policy and language and recommended policy language for all of these components are outlined in our model policy. So just to let you all know, everything is included. Next slide. Next slide, it has a screenshot of Healthier Generations model policy, which is a table of contents. This document includes policy language that covers an overview of the minimum requirements of the local school wellness policy, an overview of the model policy and how to use it, and a preamble statement to define the purpose of the local school wellness policy and suggestive language that should be included from the local level. Next slide. Here's another physical activity break, stretching. So again, participate in those reverse lunge stretches. And as I go through the additional information in the model local school wellness policy, 20 times or 10 times on each leg, 20 total. Next slide. Healthier Generations Model Policy has additional language, which includes out of school time policy language for out of school time settings such as academic enrichment programs, summer day camps, specialty programs, etc., to support students' academic and emotional development as well as reinforcing healthy habits. Background information about the WISC model and the organizations that developed the WISC model framework is also included. Language to support districts aligning to their local school wellness policies within school improvement plans to support the close connections between health and chronic absenteeism, and recommended policy language to provide a close communication between the district wellness council and the leadership teams to focus on health equity. Lastly, we also have information about the WellSat 3.0, which is and the WellSat WISC assessment tools. And those two tools can be used again to create stronger, more comprehensive local school wellness policies. Next slide. Additional information that is included in this model local school wellness policy is background information, citations to support policy language to ensure compliance of the final rule, recommended policy language for each required section of the local school wellness policy that is shaded in gray, and I'll get a chance to show that to you. School districts can use this language to establish stronger policies as recommended by Healthier Generation, recommended policy language for health and physical education, recommended policy language for areas of the WISC model that is not required by the final rule, and I'll highlight those for you. Call out boxes elaborating on specific sections of the document that is highlighted in orange text, and links to additional resources from Healthier Generation and partner organizations. And finally, a glossary of terms is also included. Next slide. This slide here is an example of required policy language outlined in the model policy focused on accountability. Accountability is the USDA requirement to adhere to the Triennial Assessment that Mike spoke about earlier. This section includes the requirements of the Triennial Assessment, documentation, policy updates, and notification to the public. All key elements must be included in the local school wellness policy in order to comply to the USDA final rule of 2016. Next slide. Healthier Generations recommended policy language is shaded in gray, as I mentioned earlier. So as you see here on the slide, just an example of what that looks like in the model policy. This section encourages districts to work with their schools to develop an annually update an action plan to execute the local school wellness policy. All language shaded in gray throughout the Healthier Generations model local school wellness policy is recommended language from Healthier Generations, Healthy Schools Program Best Practice Framework. Next slide. There are call-out boxes written in orange throughout the model policy. These call-out boxes are included to elaborate on specific information provided, which includes hyperlinks to resources. So anytime that we have additional information that we would like to share with you all, or information that we elaborated on, it is highlighted in orange within the model local school wellness policy. Next slide. Again, just modeling those physical activity breaks. As you can see in that bottom right-hand corner, I'm asking you all to stand up with me again and to march in place as I take a moment to talk about the whole school, whole community, whole child model. Thank you, Kate. I can see you. The WISC model language begins on page 26 of Healthier Generations model policy. The WISC model is centered on the school while connecting to the family and the community to address the needs of the whole child. Districts should use the WISC model to provide greater alignment, integration, and collaboration between health and education. The model local school wellness policy already addressed 3 components of the WISC model, such as nutrition, environment, and services, health education, and physical activity. Physical and mental health policies and programs should be included in the local school wellness policy to focus on all aspects of students' health, as what you have seen and heard from the 2 previous presenters. I have highlighted and asterisked the family engagement and community involvement to highlight family and community stakeholders that should be involved as members of the district leadership wellness teams to meet the public involvement requirements of the USDA final rule. Some districts may already have policies for WISC components that are not required to be included in the wellness policy, such as health services and social emotional health and things of that nature. However, it's really important to at least provide links to these policies to inform the public that these policies exist and are correlated to improve students' health and academics. Really important. It's also important to be sure to address any state and district regulations related to these areas, include professionals that are responsible for implementing when developing policies for the WISC areas, such as the school nurses, social workers, facility directors and managers, etc. Next slide. Healthier Generation is in the process of developing a wellness policy builder. Let me say it slow again, a wellness policy builder. This is a need across the country. The Healthier Generations Policy Builder is an online tool that will walk users through the choice of building a wellness policy based upon the recommendations of Healthier Generations Model Local School Wellness Policy. The Wellness Policy Builder is customizable to allow districts to select minimum USDA final rule compliant language. It will provide options to include Healthier Generations best practice framework to establish stronger policies, options to include the WISC model policy language, such as physical and mental health, to create more comprehensive policy to address all components of the WISC model framework, options to include a glossary of terms, citations, revision dates, when you update and revise, and contact information. Pre-populated district information will be included once the process begins. It is not available at this time, but we are still working on it, and it will be available fall of 2021. So moving on to the next slide. Next steps. Always try to have next steps, something that you can walk away with and to implement starting tomorrow or later on today. First, review and share Healthier Generations Model Local School Wellness Policy with your district leadership or wellness council, depending on what you call them, and or both. So you have a leadership team and a district wellness council that are separate. Share it with all of these people. Review your own district wellness policy to ensure minimum requirements of the USDA final rule components are included. Use Healthier Generations model policy as a guide to identify what's included, what's not included, and how you can include that information from the model policy into your district wellness policies to strengthen that language. Identify how to include other members to the district leadership team and wellness council to expand the updates of the policy language, such as including all of the WISC components. All right. And finally, next slide, questions. And as you're asking questions in that chat box, I will, that next slide, if you could bring up the last slide. If you're interested in additional information or you would like to connect with me, please feel free to contact me. I know that's a really long email, but this will be recorded and I'm sure you'll receive the slides presentation. So it is hyperlinked and you can follow up or just contact Healthier Generation and they will connect you to me. And I'll pause.
Thank you so much, Siobhan. Again, wonderful, wonderful information. Very exciting. It's a great policy. It takes districts above and beyond, which is really what we encourage to continue districts to do. So thanks for sharing that. And we will open it up. We have a few minutes left for any questions about any information that we provided today, and we'll try to address them in the time remaining. Let's see. Let me look at chat real quick. Okay, again, some great jobs. That's wonderful. If there are any questions do come up, we'll go ahead and address those. But while we're waiting, I just want to make sure to thank our guest speakers, Kate, Hannah, and Siobhan for being able to provide some really great, wonderful grassroots down at the local level information that you all can take back. And hopefully they will be available in the future if you want to pick their brains about what and how they were able to accomplish what they are doing. And thanks, Marianne, for putting this putting this webinar together, and thanks to our team. We have a wonderful team of 8 folks from the collaborative who are on our domain, who all offer very, very insightful and experienced information. So the information that we will end up being able to put out to you guys hopefully will be very useful. Okay, so with that, any burning questions out there? Thanks, Bailey, for information about the newsletter. And Allison, about our collaborative. We can let you go 2 minutes early.
So it looks like Valerie has a question for Siobhan. She said, thank you for the presentation. And she's curious, what would citations look like for non-compliance?
For non-compliance, well, if you're thinking about using our model policy and our policy builder that is forthcoming, those citations, if you're using our actual language, and again, it's going to be just a click of a button, and it will spit out a actual Word document, and you can update it. If you're citing from any documentations that you're using at the local level or at the state level, again, those citations should be included in there, so it's referenced back to anyone that views the actual policy. If it's not, that's a hard question, just to say, if it's not up to date. I would definitely say, as you're working on revisions for your policy, one, to make sure it is up to date and it is adhering to the USDA final rule, and again, including those citations from us. We will actually have that there as a drop down where you can include that information, or it automatically will be included if you select that particular language that we've cited in the model policy, so to automatically be included into your citation section, so that you can have that information there as others are looking at it or reviewing the information, and they can go back and for research purposes, or to find out where you cited that information from. And hopefully that answer your question.
Okay, thanks, Siobhan, again for the additional info. It is 11, and it's always good to end on time. So thanks again, everybody. Just to reiterate, this will be recorded and eventually available on the Collaborative's website. Any other closing remarks, Marianne? Just again, thanks again, and it's a new year. It's a refreshing year, and get re-energized and move forward.
Thank you, everyone. Have a lovely day.
Okay. Thanks for participating today. Bye-bye.